A study by an interdisciplinary board of decent variety master mentors about what white mental health experts need to comprehend about whiteness. The board supported 162 things that included what white mental health professionals need to comprehend about verifiable and contemporary whiteness inside the mental health fields and bigger social frameworks. Self of the therapist work for white therapists, just as difficulties to understanding whiteness in clinical preparing and practice. All the more explicitly, the board gave direction on the psychological and enthusiastic changes vital for white mental health professionals to address whiteness, just as the difficulties to those changes. The scientists give clinical preparing suggestions to marriage and family advisors or MFTs and different clinicians dependent on the outcomes. Attention to the centrality of race and whiteness has step by step been developing over the mental health professions in the course of recent years. Whiteness can be characterized as socialization rehearsers and institutional structures that keep white people in force and benefit a white viewpoint. Since its commencement, the MFT profession has concentrated whiteness. The field was established and grown solely by white men, and most by far of the ladies that at last picked up acknowledgement in the 1980s and 90s were likewise white. Moreover, conventional family treatment speculations will in general edge white, middle-class social standards as sound principles for all families. It was not until late in the 20th century that authority positions at MFT diaries and expert associations included more people of color and started to perceive their work through national honors. Around this equivalent time, a review of AAMFT individuals uncovered that an amazing 95% distinguished as white. In the scholarly community, basic investigations of racial oppression and difficulties in the various appearances of white supremacy have frequently been confined by critical race theory or court. Basic race theory rose inside the lawful calling in the 1970s and has since been applied to an assortment of sociologies and humanities. Probably the most intensive investigations of whiteness have been distributed outside of the mental health professions. Only a couple of eminent models remember Billings' 2016 History for Whiteness and the Fantasy of White Supremacy, Wise's various compositions on both the individual and socio-political implications of whiteness, D'Angelo's 2018 Examination of White Fragility, and Irving's 2014 self-portraying reflections on coming to comprehend one's privilege, race, and racism as a white individual. Inside the MFT profession, distributions that address both power and race will in general apply and develop center attestations of court. Until now, the mental health writing concentrated on whiteness in the United States will, in general, attest 6 reliable topics that reverberation focal precepts of court. To start with, there is no hereditary reason for race, however, whiteness is a socially built thought that has incredible ramifications for everybody. Whiteness was made in early frontier America so as to deny privileges and rights to indigenous individuals and individuals of African drop. Thusly, a white individual's race is connected to authentic and organized racism and not constrained to one's very own convictions, sentiments, or expectations. Second, race assumes a profoundly noteworthy job in sorting out U.S. society and culture. Race should be recognized and racial mistreatment straightforwardly and proactively tended to so as to make all the more just frameworks in the public arena. A colorblind position on race isn't just unachievable, yet additionally neglects to address the differences of privilege and power identified with race. Accordingly, endeavors to accept a colorblind position hazard hurting customers. White individuals are frequently hesitant to see color since they may compare seeing color to discriminating dependent on color. In any case, not seeing color keeps white individuals from distinguishing their own racial inclinations, unmerited privileges, and the effect of institutionalized racism. Third, white individuals convey unmerited privilege and power in the U.S. Benefit can be characterized as the blessing of unmerited advantages and preferences dependent on social area, and white individuals are socially privileged based on race in any event when they are enslaved on the premise of sex, religion, sexual personality, or social class. One indication of white privilege is that white individuals sometimes, if at any time, need to consider race. Proof for this affirmation in the mental health professions might be found in the general lack of insightful work on the subject of racial oppression and whiteness. Regardless of the entirety of the mental health suggestions characteristic in hundreds of years of white oppression, exploitation, and violence against people of color, and persistent socialization propelling the legend of white supremacy, there is still moderately little research and hypothesis on the subject of whiteness. Fourth, racism and white supremacy are unavoidable in U.S. culture, present in close-to-home predisposition and connections, yet in addition, woven all through the texture of U.S. social requests and foundations. Since it is so inescapable, it is frequently hard to perceive, especially by the individuals who profit by it the most. In this way, racial justice requires a redesign of social organizations just as a change of individual inclinations. Fifth, because of their social position, the voices and points of view of people of color must be heard and privileged in issues identified with race. At long last, since race and oblivious bias altogether sway therapeutic connections, white therapists need to create mindfulness about their own white personalities and Eurocentric convictions and desires. Understanding whiteness can help white therapists have cross-cultural discussions that incorporate their own personalities rather than just talking about culture as far as others. About the entirety of the MFT writing on whiteness is hypothetical or dependent on close-to-home understanding, with a couple of remarkable special cases. As frameworks masterminds, we accept that huge frameworks, for example, the MFT field, keep up homeostasis by diverting difficulties to control. Subsequently, these hypothetical statements might be excused as a simple feeling, or lacking pertinence for family therapists. As far as anyone is concerned, there presently can't seem to be any exploration that endeavors to combine hypothesis and build up accord among specialists. This investigation was intended to address this worry by looking for agreement among clinicians with skill in preparing on multicultural issues for the accompanying inquiry. What do white therapists need to comprehend about whiteness? Whiteness in social and expert settings. 26 things concentrated on how whiteness shapes encounters inside and outside of therapy. 4 things identified with how white individuals share normal racial encounters. 6 things addressed whiteness and its connection to a background marked by mistreating people of color. 7 things featured how whiteness shapes the mental health professions, and 9 things focused on ways that whiteness awards white therapists unmerited individual and expert privilege. Numerous things likewise recognize difficulties in preparing white therapists about whiteness. A few of these difficulties related to white individuals being oblivious of the noteworthiness of race, feeling qualified for the solace of their privilege, and neglecting to see advantages of investigating their privilege. Members additionally noticed that white clinicians may consider themselves to be acceptable people with well-meaning goals, which prevents their capacity to recognize conceivably destructive unintended results of their activities. White learners may, best-case scenario, remain subjectively occupied with race conversations however sincerely shut, and at the very least utilize their unmerited privilege and power to withdraw, divert, or shut down these discussions. Members likewise addressed basic hindrances including enormous class sizes restricting open doors for profound reflection, an absence of help from one's associates as well as a foundation in instructing about whiteness, just as instructing on whiteness prompting negative educating surveys. At long last, a few members communicated hesitance to underwrite things that needed trust in the chance of progress. For instance, in light of the thing that expresses the unavoidable idea of white supremacy will lead all white mental health professionals to hold hazardous predispositions toward their customers of color, one member demonstrated solid conflict with the thing since it was excessively negative and didn't respect the opportunities for change. Strikingly, another member showed high understanding since predispositions are unavoidable and white individuals will just observe the world through their own focal points as white individuals. In any case, this member included a message of expectation, saying that with strong preparation in social lowliness, white individuals can figure out how to perceive and process inclinations to maintain a strategic distance from them getting dangerous. Along these lines, regardless of whether members concurred or couldn't help contradicting a thing, there was a reliable message about the significance of expectation and practicing individual office. Clinical preparation suggestions. Members supported the significance of guaranteeing information on points including the historical backdrop of racism and oppression, for example, the social development of race and whiteness, genocide of Native Americans and slavery, the cutting-edge instruments of power, oppression, and privilege, the chronicled and current Eurocentric nature of the mental health professions, counting the DSM, treatment models, and codes of morals, and the individual ramifications holding racial privilege has for connections. In any case, the outcomes demonstrate that for white therapists, information is important just so far as one's ability to sincerely comprehend the implications of racial oppression, feel a feeling of moral duty to remain against racial oppression, and oppose abusing unmerited force in one's own life. Family therapy and other mental health training programs are tested to guarantee that the improvement of intellectual information is offset by taking care of the passionate development and advancement of the self of the therapist. Preparing projects may bolster self of the therapist work concentrated on whiteness by building learning destinations that measure enthusiastic change, the improvement of constructive anti-racist white racial characters, individual responsibility for racial oppression, and duty to dependable activity. The things in Tables 2 and 3 offer explicit instances of self-awareness that trainers may discover supportive in creating training plans. Mentors can likewise use the outcomes to direct their associations with trainees. White trainers, especially, can display dependable utilization of their social and logical force in their associations with trainees. White trainers and trainees should likewise consider each other responsible and fight the temptation to trouble people of color with the pressure they may feel in showing them privilege. In particular, white individuals need to challenge other white individuals about unmistakable racism and microaggressions in manners that oppose reactivity and rather make opportunities for exchange, remembering that quietness and outrage just shut down opportunities for change. Teachers, directors, and different pioneers can likewise regard the messages embraced by this examination that advocate for customary discussion with racially various gatherings of individuals who are focused on social justice, and to rehearse consistent carefulness and basic idea about how effectively one might be selected go into supporting and fortifying the status quo of white privilege. The consequences of this examination make one wonder of how to go about effectively encouraging development toward the learning results indicated in Tables 1 through 3, while exploring difficulties recorded in Tables 4 and 5. We trust that the consequences of this investigation will motivate more distribution of successful preparation techniques. Be that as it may, this examination has solid ramifications for anybody that tries to prepare white therapists about whiteness. The outcomes propose that experiencing one's own instruction, preparing, and individual change around race and whiteness is an essential advance toward having the option to adequately prepare others. The outcomes additionally propose that crafted by understanding being white is rarely finished. Hence, it is basic that the individuals who try to prepare others stay occupied with networks that will keep on testing them and bolster their own development. We presume that successful instructors and coaches on whiteness draw intensely upon their own development encounters to advise their preparation endeavors. The present investigation may likewise supplement educating, preparing, and oversight methodologies identified with multicultural preparing from inside and outside of the MFT calling. Notwithstanding, extra research could give evidence-based direction on educating and preparing white therapists. Thanks for watching. Don't forget to like, comment, and subscribe for more tips, information, and advice from Wellness World.